Okay, so we get a 6-year-old boy brought to the emergency department by his parents due to red colored urine and swelling around his eyes. So that tells us the periorbital edema, and his legs would have pitting edema. And he has sore throat 3 weeks ago. Blood pressure is elevated, systolic, and periorbital edema, mild pitting, and red. There's some blood in his urine and also protein. And rapid stress is negative, but he does have elevated ASO titers and decreased complement C3 levels. Okay, so symptoms started like 3 weeks ago after a sore throat. So this is like a streptococcal infection likely. And so what we're thinking of with hypertension, hematuria, and swelling is a nephritic syndrome. So hematuria and mild proteinuria would suggest that there's some glomerular inflammation and damage. And so when we're choosing between these, we have to realize which hypersensitivity reaction it's going to be. We have a low complement C3, and that suggests that complement consumption is occurring due to immune complex formation. And so all these things should make us think of post-streptococcal glomerulonephritis. And this is a type 3 hypersensitivity reaction because you need 3 things to form. You have to have the antigen, you have to have the complement, and you have to have the antibody. So type 3 hypersensitivity reactions occur whenever the immune system makes antibodies like IgG against foreign antigens, and then these antibodies bind to the antigens, forming immune complexes. And then they travel in the bloodstream, and then they deposit, in this case, the kidneys, and it causes inflammation and damage and blood in the urine. So what happens is the antigen comes in, the strep, and then IgG is produced to bind to it, and then the complexes circulate and then deposit. Complement is activated, and it attracts neutrophils and causes damage. So let's talk about the other ones. So the correct answer is going to be D, but why the other ones are incorrect. Okay, so A, activation of the cytotoxic CD8 T cells against the renal tube. Okay, so this would be a delayed hypersensitivity because it's CD8, and that's mediated by T cells, not immune complexes. And so it doesn't have this rapid onset of nephritic syndrome with low complement. Cross-reaction of bacterial agents. That would be a type 2 reaction. That's rheumatic fever, which involves molecular mimicry, causing direct autoimmunity against the joints and the hearts. It doesn't actually cause these formations of the immune complexes. Degranulation mast cells, that's just type 1. That's an allergic reaction, IgE mediated. Direct binding of autoantibodies in the capillary membrane. So autoantibodies directly binding would be like Goodpasture syndrome. That's a type 2. And that's when antibodies directly bind against the basement membrane and they don't circulate as immune complexes. And that would have some lung involvement like hemoptysis. So type 3 reactions, you think of SLE like lupus, rheumatoid arthritis, reactive arthritis, polyarthritis nodosa, PSGN, and IgA vasculitis. So let's look at what this would look like. Inflammation you can see here, and here are the immune complexes that are seen on the green staining. So this is acute nephritic syndrome. Elevated ASO titers and low C3 suggests that we have PSGN, type of class type 3 hypersensitivity reaction. And we've explained some of these other answers, but that's the basic idea. So type 3 things are stuck together: the antigen, the IgG, and the complement. The way to remember it: it deposits in the tissues, causing inflammation, and the diseases that cause it: lupus, serum sickness, and Arthus reaction. And so hopefully this is helpful. Immune complex deposits and inflammation, think type 3 hypersensitivity.